All right. Well, welcome to the 14th annual Jubilee Film Festival and the 56th annual Bridge Crossing Jubilee. As you may be aware, this event commemorates Bloody Sunday, which is a day that a line of peaceful marchers who were protesting the murder of Jimmy Lee Jackson were beaten on the Edmund Pettus Bridge. We are also commemorating the 1965 Voting Rights Act, and we are also commemorating the Selma to Montgomery March. I want to welcome each of you. I thank you for your time. I thank you for coming. This is a very different kind of Jubilee. Anyone who is familiar with the Selma Jubilee knows that this time of year, we would be in like day 6 or day 5 or 6 of festivals. We normally have 40 events that take place over a week. But with the advent of COVID, we are all virtual, and I think we have something like 8 or 9 events, maybe 10 over 3 days. So this is way different. This is our first virtual film festival. And this is our first time working with this platform, so it appears we're working out a lot of bugs. That being said, just want to welcome you all and thank you all. What we're going to do is ask each of you to introduce yourself, to share just a little bit about yourself and your work, and then we're going to kind of jump into the meat of this panel. And with Mr. Nile Muhammad.
Okay. Good afternoon, everyone. I am a Sayyid board member. I work as a behaviorist in Grand Rapids, Michigan at present. And I am also the founder and the director of a blog that will launch this month, and it's Seed's blog, and it's called the COVID Black Conduit, and it will basically cover all of the effects and affects of COVID on Black around the country in various areas of activity. But I would imagine at some point we'll deal with that a little later.
Thank you, sir. And Dr. Lucenia Dunn.
Good morning, everybody. Can you hear me?
Good morning.
Yes, ma'am.
I am Lucenia Williams Dunn, former mayor of the city of Tuskegee, founder of the Tuskegee-Macon County Community Foundation, and one of the founders of the Movement 46. I enjoy talking about all of this, but my real commitment is what do we do about it? I am a native of Tuskegee, and I am here to serve rural communities throughout the world.
Thank you so much, Mayor Dunn. And Brother Minister Abdul, Malik, Sayyid, Muhammad, Dr. Muhammad, can you please introduce yourself and your work, sir?
Yes, sir. Thank you, Brother Scott. I am the student Western Regional Representative for the Honorable Minister Louis Farrakhan and the Nation of Islam. I am over about 30 states representing the Nation of Islam. And I've been involved with so many things. I do a lot of gang intervention where we have settled over 400 gang wars here in Los Angeles. And just 5 years ago, the Honorable Minister Louis Farrakhan put me on a mission with Bobby Kennedy as it relates to vaccines in our children when we found out that the CDC whistleblower, Dr. William Thompson, has admitted that he and his co-authors lied about the MMR vaccine. So I have been in that mission for about 5 years, and I'm honored to say that I'm also one of the co-executive producers of this new beautiful and powerful documentary called Medical Racism, the New Apartheid, with Bobby Kennedy and I, with others who have been working to warn our community to do not become a part of some experiment, as they're telling you that this, what you're going through right now, it's not a vaccine, it's an experimental, meaning they don't know what it's going to do. So that's my mission. That's what I want to do right now, is to help sound that alarm, because now they're doing it to us in plain sight through our fears. Thank you.
Thank you, sir. I appreciate it. And I'm going to pause because I don't want to be a savage. We are in a movement meeting, and I did not open us up in prayer. So with you all's permission, I would like to take a pause, ask your forgiveness, and may we pray, please. Let us pray. Merciful Creator, we thank you for this day. We thank you for this opportunity to be at work. We pray that your spirit would be in our hearts and minds and guide our hearts and minds to love and truth. Amen. Thank you. Okay, Dr. Helen Yaffe.
Hi, yeah, so I am a university lecturer of economic and social history. I specialize in Cuban and Latin American development. And I've been writing about the development of medical science in Cuba, as well as its medical internationalism. Some of you will know that over the last 60 years, 400,000 Cuban medical professionals have gone around the world to serve underserved populations completely free. And in the context of COVID-19 pandemic, I produced a documentary with others last year called Cuba and COVID-19, Public Health, Science and Solidarity. And thank you very much for the invitation. It's great to be here this afternoon, because it's afternoon for me. I'm connecting from rather chilly Glasgow in Scotland in the UK.
Thank you, ma'am. I really appreciate you accepting our invitation to join us today. We have a lot to discuss with you. And Mr. Kennedy.
I'm very happy to be here. I actually lived for a year in Lowndes County, Alabama, which is the next county over from Dallas County. When I lived almost 2 years there. I lived in 1980 when I was running my uncle's campaign in the South, Teddy Kennedy's campaign, who actually helped end the Tuskegee experiment in 1973. But I went down there earlier in 77 as a college student, as a college senior, to write my senior thesis on Judge Frank Johnson, who was the judge who did the order, who issued the order that allowed the marchers to go over the Edmund Pettus Bridge. And I turned that book, that thesis, into the first book, the biography of Judge Johnson, and have remained very close to that family. His nephew actually is living with me here in Los Angeles right now. But I spent a lot of time in Selma and in, and working. I spent a year working on writing a history of the civil rights movement in Alabama. This film, we made this film. I'm the president of Children's Health Events. Our job is to make sure that we're not anti-vaccine, but to make sure that we have robust science and that people understand and can make educated, informed choices about their own medical well-being. And we're against mandates. the purpose of this film was really to help African Americans in this country understand the history of medical racism in this country, and also give them enough fodder so that people can protect their own health. They can ask the right questions, not only of their physicians, but also public health regulators. And I hope we succeeded in doing that. I'm very grateful to Tony Muhammad, who's become a very, very close friend over the last couple of years, working on this and many, many, many other issues.
Thank you so much, sir. And we have with us also from Iran, Brother Majid Azizi, who is translating for Brother Javad Yaghmouri, who is having technical difficulties. He's not been able to sign on. So maybe we can communicate some in the chat. But please, Brother Azizi, would you tell us where you are now and kind of introduce Brother Javad and his film Out of Airways to the audience? And you're on mute.
Mute? Can you hear me now?
There you go. Yes, sir. Salam alaikum.
Salam alaikum.
Alaikum salam.
Okay. Can you speak me?
Yes, sir.
Okay. I'm Majid Azizi. I'm a freelance documentary filmmaker. And now I'm here to translate for my co-worker Javad Yaghmouri, who is the director of the documentary film about the pandemic of COVID-19 in Iran. And I don't know, he's able to hear us or...
He can hear you. We're gonna, Sister Erica's working with him in the chat. We're gonna try to work something out where he can share. But thank you. So
That's your service,
thank you, sir. So let's begin here with just a little bit of an explanation. We wanted to have a discussion that took us out of our own bubbles about COVID-19. It's one thing to, and can you go back on mute, Brother Azizi?
What?
Can you put your mic on mute? There you go. Thank you. It's one thing to try to deal with this problem, you know, with your city or your neighborhood, even your own country. But what we have found is that each country has a media system. And these media systems begin to, you know, distort. There are agendas, there are aims and objectives that the media has in collusion with the states. And so we wanted to take people who have voices through their films and introduce them unfettered to audiences so that we could get a different feel. And we didn't want to just do this locally. We wanted to do this internationally. We had originally got a film. We won't call the film's name. It was a film from China, and an awesome film that was made in a Chinese hospital. There was an order by President Trump that prohibited filmmakers from filming inside of hospitals. And so people began to fall into conflict and confusion because we could not actually get what is the real story, what's really happening here. So we saw mistrust, we saw anger, we saw confusion, we saw a lot of grief, but people were fighting about whether hospitals were actually full or whether they were empty. People were fighting about whether people were dying or whether the numbers were fabricated, whether there were so many cases. We didn't know, but in China, they had a filmmaker, and you saw lines stretched out side of the hospitals. You saw people in the hospitals. They filmed people dying in the hospitals. And that gave us a different appreciation, because China's politic is different from our politic. You know, they're not working with whoever, you know, whoever the media kings are over here. They're at odds with China. So we're looking and saying, well, what's going on in China? And then we saw after Wuhan that the virus, the pandemic, the virus at that time moved from China to Iran, which raised a lot of questions in communities, because people were saying, how is it that the enemy of America and Israel, why are they having the virus problems? But then, according to some scientists, they said that the people of Iran shared a similarity, I think a phenotypical similarity with the people of Italy, and the virus jumped from Iran to Italy. And from Italy, it spread not only through Europe, but around March 11th, we had our first publicly acknowledged case in Cuba, reportedly from 4 Italian tourists. And I was I was blown away by what I saw in Cuba. And I want to share this screen. Hold on 1 second. Do you have it? Thank you. I want us to just take a look at something. In Cuba, around March 11th, Cuba had its infection around the same time America was experiencing its first infections. But if you look at this document, you'll see that Cuba has 11,340,000 people in this population. Through the end of the year, and Dr. Yaffe will have to correct me on the numbers, through the end of the year, I think Cuba had only experienced 144 deaths. And Cuba had something like 12 or 13,000 infections for a population of 11,340,000 people. Can you enlarge that? If you take a look at this chart that we put together, you'll see, and can everyone see it? You'll see towards the bottom, Tennessee, Arizona has 279,000 people, and it had over 816,000 cases. It got little again. Okay. The sister is expanding it for us so we can see it. Yeah. You had 15,980 deaths in Arizona. You had more deaths in a smaller population than you had total infections in the population of Cuba. Tennessee, same thing. In Tennessee, you got 6,829,000 people. You had 780,000 cases. 11% of Tennessee has experienced infection, with over 11,000 deaths. If you look at Ohio, which has a similar population to Cuba, Cuba has 11,340,000. Ohio has 11,690,000, but Ohio has 976,230 cases as of this morning, 8.3% of the population, and 17,502 deaths, and over 2 million, close to 3 million vaccinations. You go back up to Cuba, 11,340,000 people, and as of this morning, 54,000 cases, for 0.4% of their population has experienced infection, 652 deaths, only 52,000 662 vaccinations. One more. If you look at Georgia, which has a smaller population, 10,620,000 people in their population, but Georgia has over 1 million cases with 9.5% of the population infected, 17,815 deaths, 2 million vaccinations. And I want to talk to Yaffe because from what I understand, the total count of deaths and infections actually increased by triple since the beginning of the year. Can you tell us a little bit about that, Dr. Yaffe?
Yeah, thanks for that. Can I just say that I'm a bit confused about your total death statistic. It seems to be double what I know is the statistic. So I've got that the total deaths are from yesterday, and this is from the Cuban Ministry of Public Health, 344. So there may be a typo in that. It's actually almost half.
Okay, I appreciate that because that's when I first pulled the statistics up. That's what it had was in the 300s. But this morning when I pulled it up, it had 652.
Right.
So I thank you for that. And that just further emphasizes the point that Cuba is doing something very right.
Yeah.
And America is doing something very wrong.
Completely. So as you said, by the end of 2020, the total deaths was around 145 for 1 year. But the Cubans had opened their borders in late November, partly because they had it so under control. They'd had a long period with no deaths. Several days would pass with no deaths. But secondly, because they have almost been forced to, out of economic necessity. We have to understand that the impact of COVID-19 on Cuba, which is a small Caribbean island, like the rest of the small Caribbean islands, heavily dependent on tourism. So its economy has been battered. Their GDP has fallen by 11%, but it's compounded in the case of Cuba by, first of all, the Trump administration has massively and punitively increased the economic sanctions against Cuba. So the economy was already struggling from 2019 because the Trump administration was trying to stop even oil getting into Cuba to try and create the kind of crisis they had in the 1990s after they lost all of their trade and partnerships with the Soviet bloc. And, the Cubans are suffering from food scarcity. So you have this incredible dichotomy. On the one hand, they have world-leading medical science. They can, have lung cancer immunotherapy. They have treatments for diabetic foot ulcers, which reduce the need for amputations by 72%. They have 4 candidate vaccines. Now they have 5, but the 5th hasn't started trials. But this is for COVID-19. They have vaccines that they produce for their own population, for their children. Cuban children are immunized for 8 domestically produced vaccines out of the 11 that they receive. So they have this incredible record, but at the same time, and I was in Cuba in December, right now, people have to get up at 4 or 5 in the morning to get into a queue to try and access the food that they want because the economic situation is so bad. So because of this, they opened up the borders. There was a lot of Cubans who lived to come home for the festive season to spend time with their families. And you are right that as a consequence of that, community transmission became an issue. So in January, they had more deaths than they had in the whole of the previous year. And they have reacted in the way they initially reacted by, really sensible, strict procedures to stop and cut community transmission. So If you like, I can talk to you a bit about Cuba's response and why they've managed to keep the numbers so low.
I would love to talk about that, but
Helen, can I ask a specific question? What
yes,
what are the deaths per million today in Cuba?
Okay, so in January, I can tell you when it was at its worst in Cuba, it was 12 per million.
it's less than one.
And
that
compares to 1,500 per million in the United States.
Right. Cuba's death rate is less than 1/100th of a percent. But I'm going to ask us to hold for one moment because Azizi is out of town, and he agreed to come on to help translate and share the work of his comrade, his colleague, brother Javad Yaghmouri. And as we all know, Iran was the second nation to really bear the brunt of the COVID pandemic. And I believe it hit the city of Qom, and there was a particular hospital that was really hard hit. And Brother Azizi, can you tell us about that? And can you tell us about the film, which anyone who has not yet saw Out of Airways, there's a film in our film festival called Out of Airways. Our film festival is running through Sunday night, unlimited views with an all-access pass for 12 films. This film, Out of Airways, I felt was a beautiful representation of the universality of humanity. The people of Iran are demonized here. They're not even people. They're all terrorists, right? But when you look at this film and you see a son caring for his mother as she dies, I wanted to make sure that we included that because we have to get over these artificial barriers that are being imposed by others on humanity. So can you please, Brother Azizi, tell us a little bit about that film and the hospital that you all were able to film in? And you're on mute.
Who are they calling on?
Can you hear us, Brother Azizi?
Can you hear me now?
There we go.
Can
yes,
you
sir.
know? I decide.
Yes, sir.
So yeah, I can tell the situation around the election time, and there was a rumor that this disease virus. After a while, I guess, or after the rumors, the government and the media to pay home city. You know, home city is the religious city that the religious are gathered there, all the ulamas, I mean, ayatollah, you know, it's their role in the, like, so request that you have guarantee.
Brother Azizi, you have a bad connection. Hear me?
Yeah.
You have a yes, sir. You have a bad connection. It's chopping your words up, and I know that most people are probably as anxious as I am to actually hear what you're saying.
Okay, so we have a problem.
Yes, sir.
Something. No. To you. So maybe and here, well, Okay, so
I tell you what, dear brother, try, if you would you please type your answer in the chat, and we can all read it as it goes, because we need
sure,
to move.
but there are, like, I mean, just remove from chat.
Oh, he doesn't have the chat. And I apologize, everyone. Like I said, this is a new platform with new technology, and we're all trying to get used to it.
I guess that's why.
Okay. Well, I'll tell you what, Brother Azizi, this is our first global conversation. And what we will do is we will invite you back for a second conversation, both you and Javad, so that we can like really get into your culture and your film. Is that okay?
Yes, it's okay. Sorry for the trouble.
No, brother, I apologize for the trouble. Thank you for the trouble you took to be on. God bless you and thank you.
Thank you. Thank you for having us.
Salam alaikum.
Salam alaikum.
All right. So as we were saying, after Iran, the virus popped up in Italy, and from Italy, it spread, and it spread to Cuba. One of the things that I would like Dr. Yaffe to speak to, in your book, you had a whole chapter on the biotech industry in Cuba, and you mentioned one of the drugs. I think it's called Heberpro P, and Heberpro P has reduced. I think there was a trial of over 165,000 people with diabetic ulcers on their feet, and this drug cut the need to amputate by over 70%. There are rumors, sorry to spread rumors, but there are rumors that one of the reasons that the Trump administration puts sanctions on Cuba is because there was interest in America of obtaining the new treatments, therapies, and vaccines, and that they felt that that could be used as leverage. Are you aware of anything like that?
No, I mean,
and you're on mute.
Yeah, so there remains a powerful lobby in based in Miami of, they call themselves Cuban Americans, although we are talking about, you know, second generation and so on, who still have incredible leverage over the United States policy towards Cuba, and they have used that leverage to make Cuba policy almost part of US domestic policy. And I'm not an expert in the US political system or US domestic, you know, policy, but it is clear that there is over 60 years with an incredible amount of funding through Congress, through the US establishment, there has built up an incredible layer of vested interests who make their careers out of policies of hostility towards Cuba. And there are some, you know, inside Cuba who benefit from that, who have who sustain their living by being recipients of money that is part of, as they call them, democracy promotion. The Cubans call them regime change programs. So it is no surprise that, you know, any steps towards improving relations are obstructed by these interests. They are honestly people who have made careers out of adopting and pursuing hostility against Cuba. And what we want to get out is the message that you just articulated, that Cuba has medical treatments and medicines that could benefit people around the world. So the example that you used of Heprapop P, someone has done a calculation that over 50,000 US citizens who currently face amputations because of diabetic foot ulcers would not have to have those amputations if they had access to this Cuban drug. And then another example, you know, lung cancer is one of the biggest killers in the United States. And the Cubans did something that no one else had been able to do. They managed to use immunotherapy as a cancer treatment. And at the moment, both of these things, the Heprapop P has been used on tens of thousands of people in Cuba, and it's been used on 100,000 people within 10 years around the world. So it's not just the Cubans that have access to this drug. Already, tens of thousands or hundreds of thousands of people around the world are benefiting from Cuba's investments in public health. And there's something I want to point out about Cuba's medical science and biotechnology and vaccine development. I think it's a really important point. First of all, it was set up with the intention of meeting public health needs. And that is distinct from how biotechnology was set up in the United States in 1976. It was set up by a venture capitalist and a biochemist. And the objective was the pursuit of profit. And that has been the model for biotechnology around the world. And the Cuban system is very distinct. Their biotechnology and their pharmaceuticals is set up 100% by state investment. It is 100% owned by the state. There are no private interests involved. There is no private speculation. There's no private money to be made. And the point about this sector is to meet public health demand. That is how it was set up. So biotechnology in Cuba started in response to a dengue epidemic in 1981. It proved itself quite phenomenal and world leading when they produced the world's first meningitis B vaccine in 1988. And by the way, it is US embargo, as people say in the US, and US blockade, as the Cubans call it, which has stopped countries in Africa and Latin America from even receiving the meningitis B vaccine as a donation, right?
Yes,
and you know, meningitis B kills, you know, so many children, etc., in the global South. And as we are comparing the statistics that Cuba has, even for COVID-19, with the US, you can see how much unnecessary loss of life there is, because Cuba's contribution and their example is censored and the rest of the world is denied access. And it's really important to remember that the embargo or blockade of Cuba is not a bilateral affair. It's not something that just affects Cubans. It actually has an impact on the world, and especially on poor communities and the global South more generally.
Thank you so much, Dr. Yaffe. You all can see why this is going to have to be a bit of a series, because Dr. Yaffe was not even able to really dig into this dengue fever that was very unusual and extraordinarily virulent. And so there's a lot of question around that too. But at this, I would like to kind of pass this over to student minister, Brother Dr. Abdul Malik, because I know that Minister Farrakhan had a message in July concerning his desire for Black people in America to link up with Cuba. Can you talk a bit about that?
Yes, sir. Thank you, Scott, Brother Scott. Well, number one, July the 4th, 2020, the Honorable Minister Louis Farrakhan said to America that she should lift her embargo against Cuba and allow the Cuban doctors to come into the urban blighted areas of America and do for us what they had done for over 17 different countries, where they almost helped to eradicate, the COVID-19 effects. And so he has asked for us to start leading a campaign to have this embargo lifted. And on top of that, he also have sent many of our students. I think we may have somewhere between 8 and 14 of our students who are now studying in Cuba. And the Cuban government has offered free education. And now many of our children have become doctors, and they now are coming back into America to help us deal with this crisis in our community. So when you have an epidemic like this all over the world, no one should use their bully pulpits to stop medical treatment for humanity. This is a time where we have to drop all of the infighting in the global political banging that they're doing, because Cuba have something that the world can benefit from, and all of humanity needs to stand up, not just those of us in America, but all over the globe. If any country have something that will eradicate any diseases, we all should be wanting that treatment in our country, in our cities, in our community. And so that's what he's asking. He's asking for us, this country, to lift the embargoes on Cuba and allow the doctors to help us.
Yes, sir. Thank you so much. This is an interesting panel because everyone's kind of intertwined and your work actually complements one another's work. There's a lot that you said there, Brother Minister, but I do want to let I want to jump in with you, but let's move to Tuskegee and my illustrious mayor, our favorite mayor of Tuskegee, Dr. Lucenia Dunn. How are you, ma'am?
I am so honored to be here, and thank you. Scott Muhammad is like one of my sons, and we exchange information and we debate, but more importantly, we have the same values about what we need to do about our people as well as people around the globe. I just want to thank you, Dr. Yaffe, for that wonderful film. I went to sleep on it, woke up, and started all over again. And the reason that it was so intriguing to me is because I was born in the rural areas of the South, the rural area of the South. In fact, I was born in Georgia on my grandmother and grandfather's farm. My great aunt was the person who delivered me, and so I didn't go to the hospital until I was about 21 years old. Why am I sharing that information? I'm sharing that information because I have a strong relationship and a strong heart for rural communities. As I was looking at this Cuban model for healthcare, I began to think about not only Booker T. Washington and the Tuskegee concept for economic and community development, but I began to think about what we can do right now. I have to say this, and it's going to sound contradictory, but let me tell you, it's not. Had it not been for the embargo, had it not been for the fact that Cuba had to rely on its own creativity and innovation, we might not have had what it is. And my grandmother used to say all the time, the Lord writes straight with crooked lines. And so out of that misery came something very, very positive, and I am so grateful for that. We are always looking for models, and I think Brother Nile has been involved with trying to help us put together the health navigators, which is very similar to what is happening in Cuba, where the doctors are a part of the community. When I grew up in Tuskegee, the doctors were a part of our community. We have no hospital anymore. We had 3 when I was growing up. We have only none now. So one of the great tasks that we have before us is getting that rural hospital back into our community. But as importantly as anything else, looking at the world to see what other models are out there as we progress in the development of our community. What that means is I am really excited about the Cuban model. It makes sense. It is tied very much to what Booker T. Washington was talking about when he said, cast down your buckets where you are. And that's what the Cubans did. I understand that, and I'm not sure which one of the countries, and I might be wrong, but I think it's either Ghana or one of the West African countries, where they used the 3D copy machine, and they copied the mask and the ventilators, and then they made ventilators for less than $100. And I'm like, well, my God, what are we doing? What we need to do is start looking at all that creativity that's out there and begin to pull it together. And we also all know that the past administration was not about the people. That's just a given. That we now may have a better chance at getting certain things done. But I am a proponent of casting your buckets where you are, down where you are, because we cannot continue to rely on the government to do for our community. It just doesn't make any sense, because what you get caught into is somebody else's agenda. For an example, I did research on who was manufacturing vaccines and what the sales numbers are. $93 billion. That is insane. That is insane, because that means we could have had good hospitals throughout the 12 counties that we call the Black Belt counties in Macon County, in the state of Alabama. That means that we could have trained how many young people in the medical field. Look at what $93 billion could do. Now that's juxtaposed. Can't even say the word, but y'all know what I'm talking about. Where you're looking at the fact that had we done what we were supposed to do in this month and last month, 2020, over 500,000 people would not be dead. Which says to you and me that depending upon who is at the government, the head of the government, it will determine what's going to happen in your life and to your family and to your community. So why are we sitting around waiting on them to do something for us that we can do for ourselves? I am not going to sit down and wait on anybody to help me put together a model that is similar to the one in Cuba. We can do it. We have at Tuskegee University almost everything that we need to do it. So I am working very closely with them to develop those things that we need to have in our community as it relates to health and economic development. No, I don't get paid to do that. And most of the people that we have involved in pulling all of this together do not get paid. They're volunteers. TM 46, the Movement 46, is comprised of citizens from all walks of life who are engaged at various levels to make this place a better place. We were able to pull together the Coronavirus Community Task Force and Tuskegee University Partnership because we knew we needed all of these folk coming together, all of these organizations coming together. So it's a matter of organizing. It's a matter of commitment. It's a matter of having the values that say, I want my community to be better. So anybody listening to this wonderful presentation that thought that we were going to give them permission to do anything, stop. Come on, let's do it ourselves. From Selma to Tuskegee to Perry County, I can name 12 counties at least. So I appreciate what we're talking about now. I am very passionate about what it is that we must do. I am a race woman, period. It does not mean that I hate white people. I want to make that clear because I got quite a few white friends. What I am saying is we've got to take care of ourselves. I think the Nation of Islam is a good model for taking care of yourself, oneself, one's community. It doesn't mean that everybody has to be converted to Islam. And I know that our brother Abdul and Nile and Scott may disagree with me, and that's all right. But my point is,
no, you are correct.
I know, and Dr. Muhammad, you said it well when you said, "Hey, we got to stop all of this building walls. We need to be tearing down walls. We need to communicate with each other." Now, I'm gonna tell you, I was told not to talk to Robert Kennedy. Okay, told not to talk to him, and I was told not to talk to him because he is a proponent of not having given children vaccines. So I did my own research. I was like, who is he and what is he about and what is he talking about? So when I did my research, okay, he's got a point here. And maybe we ought to listen to what he's talking about. Maybe we ought to stop talking about whether or not you're Christian or Muhammad or Muslim, and maybe we ought to come together as people talking to people. The films are fabulous. I've seen most of them, and they are ways of telling the truth in a way that people can digest and understand. We got to do more of that. So those of you who are filmmakers, please continue to do that. So Tuskegee, Booker T. Washington is a good model. The Cubans, a good model. The Nation of Islam, a good model. Let's see what is good about all of those things. And I'm going to do that as it relates to my rural community because I'm about Tuskegee, Macon County, and the Black Belt.
Well, we definitely have a couple things that we want to highlight about what you're doing so people can actually know who actually said what you just said. In the interim, though, before we move to our community question, I did get a bit of a request from Brother Javad, who was not able to get on due to technical difficulties. Iran is also suffering from massive, brutal, draconian sanctions. If you want to point to someone in the government office as being anything like good, they need to be about the business of lifting these sanctions off of these nations. If we're in a global pandemic, which means that as long as the infection exists anywhere, it exists everywhere, you can't tell me that you're interested in putting a fire out if you're cutting the water hydrants off. You know, so these people in Iran are suffering. They are burying their loved ones, and their economy is collapsing. So they need that kind of relief. So I appreciate Brother Javad putting his film festival to share with the world what his folks are going through, what our people, our global community is going through. And yes, those sanctions need to be lifted. There was a question in the queue that I think is perfect for Mr. Kennedy. Someone asked, and hold on, let me pull it back down. Chat. Okay. I'm sorry, Ms. Kenny. Why would the U.S. want to keep effective treatments from the American people? Mr. Kennedy, can you tell us something about that?
Well, I think that's a really good question. And if you look at the strategies for this, for really Tony Fauci has spent 50 years in public health. Oh, he has survived 50 years at NIH. And how do you do that? He's like J. Edgar Hoover of public health. Wow. There are many great scientists at NIH who have stood up to the pharmaceutical industry. And Tony Muhammad knows this. Judy Mikovits is one. Bernice Eddy, who stood up to them on the polio vaccines. John Anthony Morris, who was for 40 years their expert on the flu vaccine, and stood up to them. Those people have been crushed. Locks are changed on their offices. Their telephones are taken away. They're given tiny, tiny little closets in the basement, and they're told not to talk to anybody. The people who survive at that agency are people who serve the interests of the pharmaceutical industry. When Tony Fauci came in, for 40 years, he has turned that agency into an incubator for pharmaceutical products. Oh, he doesn't do the basic research that he was hired to do. His job is to find out, why are we having asthma epidemics in this country? When he came in 1984, chronic diseases in America were 12% of the population. That means asthma, food allergies, autism, neurodevelopmental disorders, tics, Tourette's syndrome, and ADD, ADHD, speech delay, language delay. Only 12% of all Americans had those kind of chronic permanent illnesses. Today, it's 54%. That's under his watch. Has he ever done any studies to find out why the autism rates have gone, which disproportionately impact Black Americans? Why has that gone from 1 in 10,000 when I was a kid to 1 in every 34 children today? No, he will stop those studies from happening. He has a $6 billion budget and one other $1.7 billion that he gets from the Pentagon for bioweapons research and this kind of thing. He uses that money not to find out why Americans are getting sicker and sicker and sicker under his watch, but instead to develop new products for the pharmaceutical industry. Between 2009 and 2016, FDA approved about 250 new drugs, and virtually all of them came out of Tony Fauci's shop. So what he does is he distributes that money to investigators at universities all around the country. And those investigators who run those medical schools are doing clinical trials to develop new pharmaceutical products for the pharmaceutical industry, new vaccines, profitable new product, patented products. And then his agency owns half the patents on many of those products. His agency owns over 2,000 patents. And when those products hit the market, his agency and the people in that agency are able to collect royalties on those products. Well, the Moderna vaccine, which he has been pushing, his agency owns 50% of the royalties that come out of that. And he has 6 guys who work for him who each are going to collect $150,000 a year personally in royalties from that Moderna vaccine. What he did, all these other nations, we have the worst death rate. I think we have 5% of the world's population and something like 25% of the deaths. Why is that? America, that once had the greatest healthcare system in the world, it's because Tony Fauci is using this pandemic to enrich his partners in the pharmaceutical industry. He is directing He's already committed $48 billion to developing new vaccines. That's just money he's handing to these big pharmaceutical companies. The other thing that he's done is the emergency vaccines under the emergency use provisions in those laws. You cannot get emergency use for a new product unless you can show that there is no existing treatment for that disease. We knew there were treatments from the beginning. One of the reasons you're not seeing this disease spread in Africa is everybody in Africa takes ivermectin and for malaria, and the ivermectin cures this disease or prevents it. It is a proven prophylaxis, meaning it protects you against this disease, against coronavirus 19. And ivermectin and hydroxychloroquine. Ivermectin is a parasitic drug that's taken by many Africans. Hydroxychloroquine, in many countries, it's called Sunday in Africa because everybody takes it every Sunday. So they have this shield against coronavirus, and which is killing Black people disproportionately in this country. How can you explain that? And in Africa, which is all Black, it's got the lowest death rate on the planet. And the Black communities in our country have the highest death rate in the United States. One of the reasons why Blacks are dying from coronavirus is because every Black is vitamin D deficient. And we know that 85% of the hospitalizations for coronavirus have been vitamin D deficient and about 95% of the deaths. So why didn't at the beginning of this pandemic, why didn't Tony Fauci come out and say he says when he was asked privately, what are you doing? He said, I'm loading up on vitamin D. Why isn't he telling that to every Black person in the country? Stop drinking sugar drinks, start eating vitamin D. Why aren't we getting that kind of advice from America's doctor? Instead, what he did is he created these phony studies that were, quote, designed to fail, to try to kill ivermectin, to try to kill hydroxychloroquine, because if it were shown that these are drugs that his pharmaceutical partners hate. Why? Hydroxychloroquine has been around for 60 years. There's no patent on it. Everybody can make money on it, little bits of money. Nobody is making a killing. And what he did, so that is the enemy of all these vaccines. If you can show hydroxychloroquine works against this disease, it is illegal for him to give those vaccines emergency use authorization. And so what he's done is he has killed the remedies that are off-the-shelf remedies, patent expired remedies that are cheap, are readily available, that doctors all over the world are saying this works. 90% of the patients who take this walk out of the hospital. And he is killing those remedies in order to clear the path for his pharmaceutical, his mischievous pharmaceutical vaccines and his antiviral drug, which is remdesivir, which came out of his shop, which does not work, which WHO says it doesn't work. And yet he made that standard of care in this country. So that's what doctors are told to use, even though the WHO, which did the big study on it, says it doesn't work. It cannot prevent deaths from this disease. It cannot reduce hospitalization rates or the length. And yet he made that standard of care. Why? Because it enriches his power, it enriches his friends. And that's what we're seeing, this preoccupation in our country with developing, turning this into an opportunity of convenience for the pharmaceutical companies who are cashing in and telling us the only remedy is don't take vitamin C, put a mask on, lock yourself down, and wait till I give you a vaccine. And that is his strategy, rather than saying, look, there's ways to build your immune system. Take vitamin C. 10,000 units a day. Take vitamin D, and particularly vitamin D3, and particularly if you're Black, you should be taking that. Get plenty of sunlight, get plenty of exercise. Reduce stress in your life. Don't lock yourself in a house. Reduce your level of stress. Don't close. 1 million Black-owned businesses, 60% of them permanently. That is a stress you're putting. I read this week that there are 235 million people around the world who have put into dramatic food insecurity, starvation. Large amounts of those people are going to starve to death. There are 10,000 children in Africa who die every month. Why? Not because of coronavirus, because of the lockdown. Tony Fauci never did a study to say, is the lockdown going to kill more people or is coronavirus going to kill you? You put 235 million people into starvation. We know that when you put people out of business, it kills people. There's a famous study from 1982 that shows that every 1 point in unemployment kills 37,000 Americans. So now the population's doubled, so it's 50,000. They die from suicide, they die from stress, they die from heart attacks. He never did that analysis. He never did a risk assessment and said, yeah, we're going to have a lockdown and the lockdown's going to prevent this many deaths, but the lockdown is going to cause this many, the drug addiction and the PTSD and the child abuse. When people are locked home with their kids with no hot lunches, the only lunches those kids were getting were at school. And those kind of assessments were never done because he single-mindedly wants one thing, which is to enrich his pharmaceutical partners. And that's why we have the worst health outcomes in this country of any country in the world. I know I talked too long, but I want to say one other thing. I've been down to Cuba many times and met with Castro. In fact, just before he died, but in 94, I went down there to negotiate with Castro about a nuclear power plant, trying to get him to not build a nuclear power plant. He ended up not doing it. And during that trip, he sent me to a village that he had established in the middle part of Cuba. And that village was all people who were refugees from Belarus and Russia from the nuclear disaster there. And he had taken in all of these kids that were going to die from leukemia and from these other diseases because they had received so much radiation exposure. And he had hundreds of Cuban doctors, and Russians were sending their sickest kids to Castro to get healed, to get cured, to get taken care of. And it really opened my eyes about that medical system in Cuba and about how much we have lost in this country by not opening our doors to what's happening there and embracing our brothers and sisters in the South. The last day when my uncle, President Kennedy, was killed, he had his ambassador, a secret ambassador, a guy called Jean David, who was a leftist from France, and he was the editor of L'Observateur, which was a left-wing newspaper, and he had sent him to Cuba to negotiate an end to the embargo and boycott with Castro. My uncle said to Castro, we don't care what kind of system you experiment with there. It can be Marxist, we don't care. The only thing we care about is we don't want Cuba to be a base or a military base for the Russians in our hemisphere, and we want you to stop your campaigns of harassment against the Alliance for Progress democracies throughout Latin America. And if you agree to do that, we will normalize relations. And Castro was meeting with my uncle's ambassador when he picked up the phone and learned that my uncle had been shot. And he said, well, it's all over at that point. So I agree 100%. It makes us look like a bully to the world, and that's what my uncle was very worried about. Why is a nation our size trying to bully a little tiny country that is doing its best to bring prosperity and health and enriched and prosperous lives to and dignified lives to its people? And we don't have a right to do that. Anyway, I'm very, very happy to be here. I have a hard end. I'm going to have to leave in about 10 minutes. I've really, really enjoyed this tremendously and getting to know all of you.
Could I make a comment?
Well, we're going to have
just real quickly. All that we have said boils down to racism and greed. Those are the two concepts that have put all of these countries, including my country and my people who are African Americans in this situation. And we need to stop talking about this as though it has some kind of other kind of thing. It just boils down to two things: greed and racism.
Thank you so much, Dr. Dunn.
Hey, Brother Scott.
Yes, sir.
You know, I just want to say this real quick. I don't believe the American people realize that during the Nixon administration, do you know that our government have a policy on depopulation? And they felt it necessary that they made this a policy under Nixon through Kissinger. And Zygmunt Brzezinski, which also was on Obama's administration, he advised President Obama to continue the depopulation policies throughout the world so that America could maintain her dominance. This is a U.S. policy. So don't tell me, man, but the American people don't even realize it. Our government actively involved itself in depopulating countries, particularly people of color, but yet we don't even know that. And so our government have always come in the name of help to hurt us. We cannot trust a government with a track record like what it has.
Thank you, Brother Minister Tony. Let me say this. I really appreciate you all's patience and your consideration of letting one another, like get your thoughts out. This panel, in truth, could have just had any one of you on, and you could have carried an hour and a half with no problem. You all are artists, filmmakers are artists. And so you're all passionate, and that passion and the information and the message. Let me say this for everyone in the chat. If you have not saw Medical Racism, you need to sign up, Jubilee Film Festival, .eventive.org. Our festival is going on through Sunday night. Go and watch Medical Racism. You need to see it. And look, as they say, on the circuits now, these men, Brother Abdul, Malik, Sayyid, Muhammad, and Brother Robert Kennedy, they got receipts, man, for everything they say. You cannot dispute anything that you see in that film. And if you think you can, then email me and I will organize a community dialogue, a deliberative dialogue, where we can get it in for real. Now, my job is kind of difficult today because, again, I think Dr. Dunn spoke to it. You have to see Dr. Yaffe's film, Cuba COVID-19. Oh, my goodness. You need to see the reason why Cuba did not suffer the way we suffered here. Okay? Now, my job, as I said, is difficult. I'm like a conductor of an orchestra full of stars, and everybody's been playing real nice, but now we're going to get a solo from Nile Muhammad. Mr. Muhammad. you know, Robert Kennedy Jr. was banned from Twitter. And one of the things that
Instagram
I
too.
saw, and Instagram too. In fact, they banned him from social media the same way they banned Brother Farrakhan from social media. And what we're seeing is that a climate is being created that is designed to produce shame in those who are not interested in taking the pharmaceutical company's product. These words have been conscripted to use like vaccine hesitancy, vaccine resistance, and one of the favorite labels that they put on Mr. Kennedy, anti-vaxxer. These are not words that originated in our community, but were imposed on us from other communities, or should I say another community. Would you talk about this phenomena with the pharmaceutical companies? I don't want to pigeonhole you because you really haven't had a chance to speak, you know, to things, but I would like you to address that, and then from there, you know, a couple other things. And before you get out, Mr. Kennedy, we do want a closing statement from you. Brother Nile Muhammad, you didn't fall asleep on us, did you? He's on mute. You're on mute. You're on mute, sir. Okay, well, while we're waiting on Nile to unmute, Mr. Kennedy, you said you needed to out. We got it. Yes, sir.
You're on. Myself or Mr. Kennedy?
For you, sir. Nah, we're waiting to hear from you.
Okay.
Yes, sir.
Okay. The question that comes to mind for me is if can you hear me now? I'm unmuted. Can you hear me?
Yes, sir.
Okay.
Yes, sir.
If the vaccines are a panacea, then why are they being sold? Why do you have to sell a panacea? Okay. Why is there such a thing as hesitancy? Why is there such a thing as vaccine guilt? Okay, where some people are getting the vaccine and they feel guilty about receiving it because there are other people they feel should get it before them. So why is this, you know, why are these thoughts permeating the particularly vaccine hesitancy, permeating the atmosphere? Why is that? Okay, because the track record of those who are administering the vaccine and producing the vaccine, manufacturing the vaccine, distributing the vaccine is not good at all. The track record is totally funky, you see? So why would I put my faith and my trust in them? Okay. I would rather personally eat glass. Okay. Let me give you, for instance, 4 months ago, actually in October, the Nobel Prize in Chemistry went to two women, Jennifer Doudna and Emmanuelle Carpentier. And they created what is called a CRISPR. Okay, these are genetic scissors. And with these genetic scissors, you can change the DNA of animals and plants and microorganisms with extremely high precision. All right. They were given the Nobel Prize because they have come up with a way to rewrite the code. Okay. But while they were reporting this monumental scientific achievement, in the same breath, they were saying that there are ethical concerns about the CRISPR technology. Okay, it's a potential minefield. Why is CRISPR controversial? Why is it unethical? Okay, why would you put that in the same breath as such a monumental scientific achievement? Okay, genome editing has transformed people's lives for the better, but it raises ethical and socio-political questions. Why is that? Okay, when you can use a tool, a molecular tool that can make precise incisions in genetic material, why is that a problem? That's a major problem. When your ethics are out of whack, when your motivation is out of whack, okay, that's a problem. Okay, societal factors are a political distraction. When you come up with something like that, you really don't care about, why people contract disease and why they are affected by, existing ailments. That's not your issue. Who cares? Okay, who cares? What is important is that we have this technology and we can do these great things with it. But like I said, on the other hand, at the same time, you're talking about ethical questions. You're talking about problems. Okay, you're talking about, an invention where you can change the course of how things are grown, the same way that you can grow GMO fruits and vegetables. You can grow a human with one of these. You can engineer a human with this. Okay, so why is this a question? Because the people who are controlling this technology are foul. Okay, and their motivation is making money, period. That's it. Okay, ethics is not important. Morality is not important. Socio-political questions are not important. You have this technology, you have this very, very virulent virus in the atmosphere now that is killing people of color, particularly Native Americans and Black people and Hispanic people in that order, okay, at horrific rates because of pre-existing comorbidity, pre-existing medical conditions. It's not the virus. The virus accelerates the process. But we're not dealing with the comorbidity. We're dealing with the virus itself, So again, the societal factors are not important. The working conditions of people, the housing, the sanitation, right? That's not the diet, does not matter, any of that. None of that is important. Those are secondary issues because we have this technology now and we have to work this technology. And that is the reason why the people who are distributing these vaccines are experiencing what they consider, what they label as hesitancy. It's not hesitancy, it's distrust. The burden of proof is on the people who are passing out the vaccine. Okay, it's not on the people who they want to inject it with. Okay, that's not the issue. There's a baseline of distrust that was begun years ago. Okay, long before Tuskegee. Tuskegee, what happened to those 400 men? That's an event. That's Americana. Okay, what Tuskegee means now is it's a cultural designation. When you hear the word Tuskegee, it means medical treachery against my people. That's what it is. Okay, it's not the fact that these men were denied medical treatment when they had syphilis. No, that was just one of many things. But now when we say the word Tuskegee, we know what that means. And that's why Black people are not lining up to roll up their sleeves and take this shot. You see? Change happens at the speed of trust. The speed of trust is not happening. So there's no change. And there won't be a change as far as this is concerned unless we are compelled to take this shot.
Which would be war.
Okay.
And Thank you, Brother Nile. And there were 600 men in that study. And Mr. Kennedy, would you care to close out your participation?
Yeah, I'm picking up on what Brother Nile said. You know, when my Peter Buxton, who was a whistleblower, can you hear me?
We
Wait a
can.
minute.
You're
Before
on mute,
you
Doc.
make your final statement, Mr. Kennedy, I would like for you to note that, and that this is for everybody, please stop calling this the Tuskegee syphilis study. It was the United States public health experiment on Tuskegee 600 men. I just want to make that point before you all leave.
And the United States Public Health Service is now the CDC, you know, which speaks back to you, Brother Nile. The reason why there's mistrust, it should be no discussion on mistrust. The discussion should be about the betrayal of trust in truth. But Mr. Kennedy, please.
That's right.
Go ahead.
Oh, Peter Buxton, who was a whistleblower, went to everybody. He was a whistleblower in the CDC. He saw what was happening in the Public Health Service, which later became CDC. He saw what was happening with Tuskegee. He was running around like a chicken with his head cut off, saying, "We got to stop this. This is insane." And nobody would listen to him. He ultimately went to my Uncle Ted Kennedy's office. Teddy held hearings on it, and that's how it ended. And CDC said it will never happen again. But that was 73. In 1989, CDC did a secret experiment on a new flu vaccine that was a very, very hyped up and a reactogenic, meaning dangerous vaccine. And it experimented in 3 places: in West Africa, in Cameroon and Ghana, and in Haiti, and on 1,500 Black children in South Central Los Angeles. And so many kids died. That vaccine killed only girls. And so many kids died in Haiti and in Cameroon. They discontinued it, and they never told the parents of those children that they were part of an experiment, which is illegal. And that was disclosed ultimately by the Los Angeles Times. I think around 1992, people figured out what had happened. And again, CDC said, we'll never do this again. In 2004, CDC did a study, an autism study on the MMR vaccine of all the children in Georgia. And while they were looking at that study, they realized the data came back and it showed them that Black boys who got that vaccine on time were 350% more likely to get an autism diagnosis than white children or than Black boys who waited. And CDC, the head of the vaccine branch at the CDC, a man named Frank DiStefano, whose own son has autism, ordered the 5 scientists who were involved in that study and who had uncovered the data to come into a conference room at CDC headquarters in Atlanta. When they got in that conference room, they found 4 giant garbage cans, blue garbage cans. And they were told to take out all of the data and all of their computer hard drives that contain the data on the Black boys and to destroy it in those garbage cans. And then they published that study.
Ooh. What happened? Uh-oh. You had a problem there. Okay.
Bobby, did you go on mute?
Looks like he dropped off, brother. So at this time, we have about 30 minutes left, a little less than 30 minutes. I want to make sure that our panelists, our audience, those who are watching, If you have questions for our panelists, please put them in the queue. Any of our panelists who would like, in fact, let's go. Considering all that has been shared today, that's kind of where I was moving to. Where do we go from here? What can we expect in the future? What actions do we need to take now? Let me start off that question by saying that the coronavirus, the COVID-19 pandemic, exposed the lack of leadership around the country and in other places around the world. We're here today commemorating the right to vote. We fought and we got the right to vote, but we never received proper voter education instruction. So though we know that we can vote, we don't know how to qualify people that should receive our vote. Why should you get my vote? In the city of Tuskegee, we were looking for a strategic plan. There was no strategic plan. And when we looked out around the country, there was no strategic plan. Cuba had a strategic plan, so you saw their numbers very small. Here in the cities in America, it was treated like there's nothing you can do. You just gotta wait your turn to die, roll the dice, maybe you'll get lucky. However, Brother Nile came up with a strategic plan. And I would like, Brother Nile, if you would speak to this question, where do we go from here? What actions do we need to take now?
Well, I can tell you about one strategy that Sayyid has adopted. It's what we call in public health PA, a non-pharmaceutical approach, in lieu of our poor health and poor outcomes and unresponsive, irresponsible national policy and poor nutrition, which is the understatement. Catastrophic consequences of violence in the community, drug, alcohol abuse, of course, diabetes, high blood pressure. We feel that our NPA will help restore equilibrium in the community. And it's an emergency action strategy, right? And it consists of 5 components. I don't want to waste any time for you to look at it, but it's 5 components. The first one is the health navigators. The second one is the Martyrs Memorial Park. The third is the COVID Black Conduit, which is a website. The fourth is the Food Security Initiative, and the fifth is quarantine and isolation facilities.
Can you come closer to the
in a
microphone?
nutshell, can you hear me?
Yes, sir.
Okay. Basically, it's like what Dr. Dunn was saying earlier. Okay, we have got to stop holding on to anachronisms, thinking that the government is going to save us, or here's a vaccine and we'll be back to normal shortly. No, this is a virus, and it's not going anywhere unless it burns out. Okay, that's no. So what we've got to do is we've got to cast our buckets where we are. We're not talking about changing the trajectory of an asteroid. Okay, we're talking about doing something for ourselves that will alleviate and mitigate some of this death and suffering. Health navigators are people, basically, in the neighborhood, lay people, students, gangbangers, right? That we create paramedical educators that basically go in the community, and we talk to people. We inform them about what they need to be doing and what they should do based on the environment, based on what's going on. Okay, that's something that we can do right now. That's something that we have done. In fact, the moderator, his wife, and myself have a strategy that we have put into effect in Tuskegee, and it works. Okay. The second component is the Martyrs Memorial Park. It is basically a replacement for a traditional concept of mental health in the Black community because they're inadequate in terms of understanding our lives, our problems, that sort of thing. So what we in a nutshell, I'm giving you a very explanation here. It's a program that's been created to identify the victims of COVID and to invite their loved ones to memorialize them with planning ceremonies. Okay. And so after that, it provides closure for the families and the survivors. And then Seed follows up with the bereaved family by way of mental assessment training and culturally relevant auditing and counseling, instead of just leaving folks out there floating in the air after their family members die from this mess. The third component, sir.
Or your
Can you?
sound
Yes, sir.
is really jacked up. Can we give you? See if you can. Maybe I don't know if it's your phone is on next to it or what have you, but we're missing words and matter.
Not. How's it now? Is it any better?
Can y'all hear him any better, Minister Tony?
Is it any better?
Yes.
Yeah. Okay. Go ahead, sir. I'm sorry.
Okay. Third component is a informational component, and basically that's our website that will be launching this month. The COVID Black Can Do It, and what we're doing is creating a space for accessibility for Black folks about COVID-related issues that have something to do with our community.
I think you got a bad connection
in the areas of human activity. I'm sorry, brother. I don't know what that is.
Yeah,
I have no idea why that is.
So we're gonna put you on hold. You know we're gonna have to.
Okay.
And let's move to some of our other panelists. I guess we're just gonna have a jam session. Is there anything that any of you would like to say?
I definitely would. Can you hear me? One of the big problems in our Tuskegee and Macon County is that we really don't know how many people have the coronavirus. And as a result, we have initiated a universal testing program, and we have done it, and we did it. We were the first to do it because we found out that our public health system was not sensitive to the situation that people find themselves. For an example, you didn't expect for them to come and get testing from 10 a.m. to 2 p.m. Most folks are working. And then you got the issue of transportation for many of our people that live in the outer skirts of our community and our county. And also we have a problem with connectivity. We don't have Wi-Fi and broadband, and our people don't have it. That's a picture of our testing right there. We had a doctor to Assistant Muhammad, Darnita Muhammad, who used her medical license for us to operate under. We were able to get various labs to do the reporting and the analysis, and we did that for free. The other issue that they had was that you needed to have a doctor's order that you could go and you get tested. That makes absolutely no sense. What we did was we said, okay, we will get the test materials, test materials, and then we will set up shop. And what we did was people came in their cars, we got their information, they got the swab, it was the nasal swab, which is the best one, and they went home, and then we let them know that they had it or did not have it. That was a simple deciding. We just decided that we were going to do that. The other thing too is that we have been putting on forums with expertise. That is, people who have different methodology for dealing with this coronavirus. But it was interesting because the one that we had last Thursday, we had two medical doctors, one scientist, biotechnical scientist, and a naturalist. That's what I call Dr. Muhammad. That is that you have the ability to take care of yourself with the vitamin D and the zinc and all those things that help your immune system. Well, it was interesting because most of our medical doctors said yes, you need to do all of those things, and in some ways, it surprised many people that the medical doctors agreed with Dr. Muhammad. The other thing is just getting to talk to people, and I think Brother Nile was talking about going and sharing information with folks. We have done that in different ways through the Coronavirus Community Task Force. Now, let me just tell you about that community task force, because it's not like a group of people coming together. It is almost everything from the funeral homes to the sheriff's department to our political class, sharing information and talking to each other. And this is the first time ever that we have been able to do that. Now, it is not perfect, but we're certainly trying to make sure that every aspect of our community comes together. A, get to know, two, sharing information, exchanging where the problems are, because sometimes people don't realize that what may be happening in the criminal world may have an impact on folks who are not criminal. And that then has something to do with stress, that has something to do with how people are responding to situations. I think Scott Muhammad has really brought to our attention about segments of our population that are sometimes ignored, and how that is impacting all of us. Finally, there's a whole cultural thing that we started talking about that we really need to do more talking about, and that is this concept of trust. We sometimes get caught up in what's going on in the television world. I remember seeing the president of the National Ad Association talking about how she was going to get involved with our community and let all of us know about this vaccine and how it was going to help us, and really was thinking that she was doing a good service to all of us, particularly those of us in the Black community. I really laughed, to tell you the truth. I was like very amused because she was talking about going to the churches and the normal things. And I was saying to myself, do you think just because you are doing that it's going to change my mind about taking that vaccine? No, it will not. What will change my mind about the vaccine is creditable information. And I think we started getting some of that on this call, on this panel, looking at the way we organize our medical health process and what we need to do in our communities. We have, and that's the Tuskegee-Macon County Community Foundation, of which I am the president, have given small grants to farmers so that they can grow the food to go into the food pantries, so that we can upgrade that, because these food pantries are really giving a lot of bread and cakes and all of that to our people, and they're day-old products and produce. So we're trying to increase that nutritional level. But as any, this is probably the most important thing that we need to do in the future. We need to develop flyers, because everybody does not have web access, Wi-Fi, and all that, and get it in the hands of our people, telling them what they need to know, helping them to understand why they have that distrust by sharing the history of the medical abuse that we have suffered as a people in this country, and having discussions about it so that we can understand why we feel this way. Sociologists tell us that sometimes something happens in the past and it's passed down from one generation to the next, and by the third generation you have forgotten exactly why you feel the way or the way you behave. You know, that's like collard greens and cornbread and cornbread and taking it and putting it in little things and then dipping it in to the pot liquor. There's a reason why that's there, and people don't even know why they like it. So, you know, I'm talking about really being straightforward and honest. Don't do that.
No,
being straightforward and honest about who we are, what we do, and why we do what we do. And so,
let me jump in with you real quick, Dr. Dunn, because I do want to give Dr. Yaffe and then Brother Minister Tony. But I do want to say this, that one of the most extraordinary things about what went on in Tuskegee was that Dr. Dunn and those working with her did not wait. You know, they did testing on their own. They began going door to door to educate on their own. When leadership was not there, they provided the leadership, and that's what has to happen across the board. And so I want to go to Dr. Yaffe, then Brother Minister, and Brother Nile. Maybe if we tinker with you, maybe if you cut your camera off, we may be able to hear you, because you are actually dealing with actionable intelligence, and so we let you close us out. We'll see how that works. So, Dr. Yaffe.
There's just been so much stuff that you know, I've been thinking, oh, I'm going to comment on this, I'm going to comment on that, and so much. But you know, as you said, I'd be here talking for another. I'd be doing a Fidel Castro length speech if I was everything. I mean, Lucenia Dunn was talking about the root of the problem being racism and greed. And I agree, racism, and I would say from the global perspective, imperialism, which is, you know, when you go and carry out your exploitation overseas. And what you describe as greed, I would say, is actually the internal logic of capitalism, because capitalism is about the pursuit of private profit. And the problem is that you cannot provide healthcare that is adequate, that is accessible for poor people, if what you're doing is prioritizing the pursuit of private profit. And that is the power and the threat of the example that Cuba provides. So Robert Kennedy Jr. was explaining that when he was in Cuba, he went to see this program where they were treating people from, he said, Russia and Belarus. This was a program that the Cubans introduced in it started in 1990. It was called the Children of Chernobyl program. And they did this because their diplomats in Ukraine heard about these children who had very high incidence of cancer, leukemia and whatever, because of, as a consequence, in the region affected by the Chernobyl nuclear disaster. And so they started to invite these children, accompanied by parents, to this camp. They set up a whole camp of medical facilities, but also the beach, entertainment, and so on. And when this program started, within a few months, Cuba entered a severe economic crisis GDP collapsed by 35%, and they had struggle feeding themselves. And there is a professor in Canada, Professor John Kirk. He was in Cuba at the time, and he asked one of the doctors in charge of this. He said, how can you carry on funding this program? Because the Cubans were funding it themselves, yeah, you know, when you're in economic crisis. And the guy was like, how can we afford not to? If there are children in the world that we can provide healthcare for, then we can't shut it down to prioritize our children over others. And the Cubans have a saying, we don't share what we have left over, we share what we have. Now, they carried on this program during what they call the special period, the period of economic crisis. By the end of it, 26,000 people had come to Cuba and receive treatment, and not just medical treatment, therapists and pediatricians and, you know, just assistance with mind as well as body. 26,000, 24,000 of those were children. Subsequently, Cuba set up the Latin American School of Medicine. And Robert Kennedy also referred, or someone, no, it was, I think it was Abdul, Malik, Sayyid, Muhammad referred to this, or one of you referred to this. The kids from the United States, mainly Black kids from poor communities who go to Cuba, and they get completely free education. And you know, they went there because the Cubans had already set up the Latin American School of Medicine, which was for people from Central America and Latin America. Why? Because in 1999, there was a terrible hurricane which affected Central America. 30,000 people were estimated to have died. And the Cubans sent medics. And they said, when we got here, we realized that there is a bigger problem. And the problem is that we can provide emergency treatment, but when we leave, we will still see this unnecessary, ridiculous high mortality because people don't have access to healthcare. So what we need to do is help these people by giving them the training so that they can serve in their own communities. And as a consequence, then other countries said, can we send people? Can we send people? And they have graduated 30,000 people from around the world for free, who are the only thing they're asked to do is go back to poor communities and to not join the private healthcare system where healthcare is a commodity. So I think, you know, we need to give back to Cuba now. And I'm afraid to say that the onus is on you. You're in the United States, which is the belly of the beast. It is the country that sustains the United States blockade. Earlier on, I posted in the chat a link to a fundraiser which is helping Cuba to buy syringes, because it has the ability to, you know, to produce this public health orientated vaccination program, but it doesn't have the resources it needs because the US blockade or embargo is preventing it. So if you can contribute to that, and you know, there is a lot happening in the United States now against the blockade. Once a month there are now caravans of people in cars and bicycles and so on are calling on Biden to lift this anachronistic 60-year blockade, which, you know, if it wasn't for the fact that the state organized and focused the scarce resources, tens of thousands of Cubans would have died. You know, look what happened in Iraq for the 10 years before the war, when Iraq was under sanctions. 150 children were dying on a daily basis as a result of sanctions. And you can see the impact in Venezuela, even though they have a government that is trying to channel resources towards poor people. There was a survey that said over 43,000 people have died in Venezuela because sanctions stop people getting medicines they need for diabetes, for cancer, and so on. So sanctions are murderous, and they are about this thing we're talking about, capitalism, imperialism, and racism. And that is our function in our own countries, is to demand that that's stopped, because we all lose out. As we were saying earlier, we all lose out At the end of the day, it's the elite, it's the establishment, it's the ruling class who benefit from this competitive, exploitative relationships globally, not us. You're muted.
Thank you. Yeah, man, it was like I was singing like Luther and couldn't nobody hear me. Thank you, Dr. Yaffe. Everyone, that's Dr. Helen Yaffe. You have to get her book. It is called We Are Cuba, How a Revolutionary People Have Survived a Post-Soviet War. There you go, by Dr. Helen Yaffe. And I would recommend, if you really want to understand this dynamic, go online or YouTube and check out some of her interviews. She's awesome. One of them with Gail Reed, I think. They were talking about the medical system in Cuba. I did not know Cuba had the largest doctor producing factory on the planet. You know, we cannot let Cuba language. And, you know, I'm not afraid to say it, Dr. Yaffe, as Black people, those are our people in Cuba. We cannot let them die under sanctions while we go chase used women, drink beer, and smoke GMO weed. Okay, that stuff got to stop. Sitting around watching television and just foolishness, man, while your people die is not honorable. You know, so if you didn't know, now you know.
I need to say one more thing, Scott.
Please.
Let's not forget that Cuba sent 350,000 military personnel and civilians to Angola to help to stop the invading army of white South Africa, the apartheid army of South Africa. And Cuba saw it as their duty to help their African brothers and sisters. So I think, you know, that the sentiment you expressed has been demonstrated by Cuba.
Yes, ma'am. And you know what? If we wanted to have a couple Cuban nationals on this call, and it was going to be very difficult to work through the embargo, which actually blocks airwaves. You know, it's totally ridiculous. So there were people who, as Dr. Dunn said, maybe, you know, hey, maybe you shouldn't have Robert Kennedy on your platform. And if you're going to have him on your platform, you need to have somebody who is so vaccine ready. And it's like, nah, that's not what this is about. You know, we give platforms to people who are being marginalized and pushed out of conversation. And we don't need the bullies who push them out of the conversation to stand over them while they tell their side of the story. You know, that's not what we're going to do. So, Dr. Muhammad, any last words for us, big brother?
Yeah, first, Brother Scott, I just want to say thank you. Listening to this group of wonderful panelists, it just warms my heart to know that we got these kind of human beings on our planet. So I'm just grateful I've been so edified listening to everyone. But I just want to say a few words from my teacher, the Honorable Minister Louis Farrakhan, and what we see is happening and what God is going to force us to do. We are now witnessing the hijacking of the amygdala through fear. Amygdala is that part of the brain that is ruled by fear and emotions. And when we are inundated with 24 hours of CNN, ABC, CBS, Fox, all of these channels and media moguls, I hope you all know that they are controlled by the pharmaceutical industry, which have absolutely taken over Congress, and has taken over the Senate. And so we're witnessing that the pharmaceutical industry have shown themselves to be the dragon in the book of Revelation, where the dragon opened out its mouth and it was a flood coming out of its mouth. And if you just listen to CNN, go get the vaccine. This is not even journalism anymore. Journalism is to be objective. You used to hear the opposing side. You may hear one scientist that's for something, but you hear the other scientists who said, no, that's not altogether true. This is what we are not getting. And we cannot continue to go down this road. It has been reported from VAERS. VAERS is an agency set up by the United States government, which they have to report how many people have died due to the COVID-19 vaccine. Do you know that according to VAERS, which is the Vaccine Adverse Event Reporting System, as of yesterday, with only 1% of those who have been vaccinated, only 1% have been reported. 1,140 deaths. Why aren't we hearing that? Over 3,000 injured, seriously injured due to the COVID-19 vaccine, particularly Pfizer and the Moderna vaccine. Now, you do the math. If only 1% is being reported and it's 1,000 deaths, what if 50% was being reported? How many deaths would that be? What if it was 75%? How many deaths would it be? So that's the problem, good brother. We are being lied to, and they are ruling us through fear. And here in Los Angeles, the preachers, the pastors now are being paid tens of thousands of dollars from the pharmaceutical industry to open up their church, to bring our people in to get a needle stuck in their arm, but yet they can't open it up for prayer. Something is wrong. And I want to close by saying these words. This is a spiritual problem. God, through this pandemic, have peeled back the mask of civility when we thought racism was done. We did not know it was hiding. Now, due to Trump, which Trump has helped to show us that we are still hated as a people. There's still a plan to get rid of us. And I'm saying, like Dr. Dunn have said, God is going to force us to do for ourselves. It is time for us to consider separating. And don't tell me that it can't be done. I live in Los Angeles. And just a couple of weeks ago, I went and met with the Asians in an area of Los Angeles called Chinatown. They've already separated themselves. I met with the Koreans. They have an area in Los Angeles called Koreatown, self-sufficient. Mm-hmm. Then I went to an area called Little Cambodia. There's an area called Little Armenia. We're the only ones still connected to those who continuously lie to us and who are trying to kill us. So the Honorable Minister Louis Farrakhan said, this is a spiritual problem. And whether you believe it or not, God loves the oppressed, no matter where they are, Cuba, Central, South America, Africa. God loves the oppressed, and God is going to do to America what he did to Egypt, what he did to Rome, what he did to every country that had a people in its border that it was not treating right. And I say this to Black people, we need to repent. We need to repent from all of the Black leaders that this government through their media marginalized and said, don't follow that one, but follow this one. We need to repent for turning on Marcus Garvey. We need to repent from turning on Nat Turner. We need to repent from turning against Sojourner Truth and Harriet Tubman. We need to repent from turning against the Honorable Elijah Muhammad, who's been telling us to do for ourselves. And I close with this verse out of 2nd Chronicles, where God says these words: if my people, which are called by my name, shall humble themselves and pray and seek my face and turn from their wicked ways, then will I hear from heaven and will forgive their sins and will heal their land. I'm telling you, brothers and sisters, do not take their vaccine. They're not telling you. 99.9% of the people who get COVID recover. They're not telling you that. There are 14 different therapies out there where you don't even need a vaccine that's totally decimating COVID. I take Paximune and have been taking it twice a day and have been around people who are sick, and I have not contracted COVID. And many of my members in my mosque who are taking Paximune are strong and they are not getting COVID-19. There are other therapies. So I warn you, Biden ain't gonna do no better. All of these people are controlled by the Faucis of the world. Fauci has been compromised. The FDA have been compromised. The same people who are telling us to take these vaccines, they are benefiting financially, Dr. Dunn. That's not right. Fauci should not be able to make money off of the vaccines. The CDC, that committee, which determines which vaccines we take, 40% of them have a financial interest in the vaccines that we are given. The CDC has a budget of $11 billion, but 4.6 billion of those dollars go towards manufacturing vaccines. So the CDC is a pharmaceutical company. We're in trouble. And our sister said it so beautifully from Cuba. Anyone that's dealing in medicine, there should not be profits associated with medicine. Because once you allow capitalism to be involved in producing medicine, the mission now of the pharmaceutical is not healing, it is profit. And when profit is put above the life of the American people and people throughout the planet, we are in trouble. Brothers and sisters, we cannot trust this government. We cannot trust a government that leans on Bill Gates. Bill Gates is a eugenist. His father hated Black people. And Bill Gates have admitted that he's gonna put billions of dollars behind depopulating our planet. He, Bill Gates and Melinda, you can go and look it up. Google him or go to YouTube. He says it outright. I want to reduce the population by 10 to 15%. And he said he was going to do it through new vaccines, reproductive health services, and all of us are having the Margaret Sanger protocol put on us. And Margaret Sanger said, find Black leader. Don't let them know that we want to totally exterminate them. And if you give them money and give them fame, they will lead their people to us. We cannot trust none of these people. So I thank you. I thank you, and I don't care if our community turns on us because we're telling them, do not take these vaccines. There are other ways. But in 20 years or in 2 years from now, Dr. Mikovich said that you will see people dropping dead like flies as a result of these vaccines. So thank you. We gotta get Cuba's embargoes lifted. Black people in America should have a movement going to lift the embargoes from Cuba so that the Cuban doctors can come in our community. We need to determine who comes to help us, not the government of America. So thank you. May God bless you. I hope you get a chance to look at the documentary, Medical Racism, the New Apartheid. I hope that we all really continue to unite. And it's time now to do for self. So thank you, good brother.
Thank you, sir. Really appreciate those words. Well, he said a lot. And you know, this is a movement town, community, Selma, and that really needs to be the movement, because if you all remember, during Hurricane Katrina, Cuba was trying to send help to us, and it was blocked by those who did not care for us. And so, Brother Nile, we want to get you on to close us out. Let me see. There was a chat in the question from Brother Timothy Muhammad. He said, how will the recent move to remove mask mandates in states like Texas and Mississippi affect the population in these areas? Is this something that should be of great concern?
Do you want me to shut down the video?
We can hear you. Let's try
portion of this for myself.
Yeah.
You can hear me now? Okay. 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 First of all, before I answer brother's question, there, brother Minister Muhammad brought up something that's very pertinent. Bill Gates and his ilk, they are hiding in plain sight. Okay, they're out here for you to see, unashamed, unabashed. They're telling you what their agenda is. Okay, a lot of people don't know. A lot of scholars don't know that this virus has a patent. Okay, it's a patent. It's 10,30,701, and it's owned by the Pilbright Institute, which is heavily financed by Bill Gates and some others. This is common knowledge. It's out here, but nobody pays attention. Nobody does the research necessary to know what's going on here, okay, and what's happening. We're being murdered like houseflies. It's happening. The government is sanctioning it. And Mr. Kennedy brought up something that he didn't mention. He mentioned the event in 1990, about 1,500 Black children being immunized. But what he didn't mention was that that vaccine was injected into those children without their parents' consent. Okay. That was in 1990, and that was the CDC. The same people that want you to roll up your sleeves. So it's something that needs to be kept in mind when you're considering getting that vaccine. As far as brother's question is concerned about the masks, the rate of contagion is going to increase exponentially in Texas. The warmer it gets, okay? Because while they're doing that, I have no idea. They have cabin fever. They want to get back to the drinking and the partying and whatever else that they're doing, and they think it's over. This, you can't see this bug, so apparently it doesn't exist, and they're ripping these masks off, and the governors are trying to satisfy and the public so that they can. They're telling them that the restrictions are off, and they're basically sentencing their constituency to severe illness and death. These vaccines prevent disease. They do not prevent infection. If they prevent disease, that's another issue altogether. So, brother, when they remove the masks, just keep your eye on the news, particularly Texas and Mississippi.
Wow, thank you, Brother Nile. You all, we went a little over time, but we really appreciate each and every one of you for sharing space with us. With your permission, we're going to close out reading the words of the Reverend James Luther Bevel, whose strategy it was that got the right to vote, that won in Selma, that was the root of the Selma to Montgomery march. This is from an excerpt from a book that we produced during the 50th called Months on the Mountain, the Selma Voting Rights Movement, as told by his biographer. And this little section is called The Disorders of Some People. He says, a lot of hotheads and so-called radicals came to Selma. I can't call them authentic radicals. They were just very irrational people who didn't understand strategy and despised white folks. The type who dealt in, you cowards, we's braver than y'all. That kind of erratic negativity and non-thinking people was present. These angry folks began to agitate the crowd. You sold out, they'd scream, not understanding the situation or the fact that the people in charge of strategy knew what they were doing. They thought the drama was about a particular one-time demonstration when the drama was about the right to vote. Nothing more, nothing less. But these people now believe that the entire civil rights movement had suddenly become a contest of black folks versus white folks. Seeing themselves as the vanguard of some kind of black revolution, their unresolved lies and hates caused them to act contradictory to the nonviolent tenets. They even began to make agreements in opposition to Dr. King and the nonviolent movement. They didn't understand one thing. Since our movement addressed errors and violations in both black and white people, we were doing principal clinical educational work, not competitive racial work. Some of you reading these words, or hearing these words in this case, may create the movements of the future. You'll be experiencing and thinking about the problems of your own time. Since other people at various moments in history have thoroughly tested the science of nonviolence and found it to be true, be assured those problems can be resolved. What you need to learn does not include who did this or who did that, what hero got his name in the paper, or which heroine brought a movement to a conclusion, or even why they did what they did. You'll need to know the disorders in people, which cause them not to think or question all the way through. And you'll need to know the disorders which motivate them to act irrationally. You need to understand that polite haters usually have problems with energetic people. Understand that every compromised person has a problem with the uncompromised and yet won't admit it. You need to know that these hidden but constantly present attitudes will directly affect your group's ability to solve social problems. Finally, you need to know that hate comes when someone imagines an external enemy and then feels intellectually and physically intimidated by their mental attitude towards this perceived foe. You should become keenly aware that if you have haters in your movement, their hatred will contribute to injustice. At some point, they will take serious action to counter justice and compromise truth. In Selma, these haters, mostly SNCC activists who assumed after talking with other people who felt the same way that their us against them attitude now defined the movement, joined Chef Jim Clark and his deputies in acting out their rage. This led to many minor incidents and actions which ran contrary to a movement decided explicitly to do one thing: obtain the right to vote. These incidents increased after Bloody Sunday. To deal with this negative force, we had to do both internal and external movement work, all during the Selma campaign. May God bless you all. I thank you for your contributions. I hope that you were edified and that you grow. For our panelists, we will be following up with you with a program book. For our audience, please go get your all access pass. Check out this film about Cuba. You need to see what your brothers and sisters are doing there. Thank you, Dr. Yaffe, for that beautiful film. You need to go check out Medical Racism, and you need to check out Out of Airways. There are other films in there as well. I think we got 12 films, all access, unlimited views through Sunday night. God bless you and take care.